Let's move on to our next question. We're going to address that, which is how do I know when I'm ready to take the NCLEX? And we give you an idea of that with our 2 targets. And so within the product, when you're using Studying with Bootcamp, you can come to your performance page here, and we've got these 2 targets. You want to meet both of these targets. And if you have met both targets, 99% of our users that pass both targets pass the NCLEX. So this is a very good goal to aim for, and the targets are just that you answer a minimum number of questions, which I haven't done yet, and answer a certain percentage of them correctly. So I would recommend that you come in here and you can do a subject by subject breakdown, and I can see, oh, I've answered fewer child health questions than in the other areas, fewer fundamentals questions, and it looks like I'm scoring okay and everything. So this will give you a way to kind of focus your studying on your weak areas, and this is what you want to aim for, is meeting both of these targets. So hopefully that answers your question about what do these 2 targets mean. And then for Michael had a question about tips for repeat test takers. And I'm going to say, if you take the NCLEX and you don't pass the NCLEX, they're going to give you something called a CPR, a candidate performance report. And this is going to show you client need area by client need area, what your weak areas are. So it might say that you were above the passing standard in safety and infection control. You've got it down when it comes to safety and infection control. But then something like clinical judgment, which they test in the case studies on the NCLEX, it said that you were below passing in. So then you know that you need to focus on case studies. And if you actually go to our study guide here, so you're going to get a candidate performance report. So if you need to brush up on pharm, let's say your candidate performance report says that you were below passing in pharm, you're going to prioritize practicing pharmacology questions. If you were below passing standard in clinical judgment, then you'll practice the NG and case studies and so on. And so basically, if you got a low chance of passing on one of these readiness assessments, or if you've failed the NCLEX before and you're a repeat test taker, is focus your studies on your weakest areas, either in your candidate performance report and or in one of our readiness assessments, so that you know you are spending your time on the areas that you're going to have the greatest room for improvement in to bring yourself up above that passing standard. All right, Lenore RN, is the NCLEX an overall mark or is it by each area? The NCLEX, although they give you that candidate performance report and they show your relationship to the passing standard for each of the client need areas, you don't actually have to pass all of them. You only have to pass overall. You have to be above the passing standard overall, not necessarily in all subject areas. So the reason that we break it apart by subject area in our performance report page here is because we don't know what kind of NCLEX you are going to have. They are randomized as far as content area. So you're going to see some child health, some critical care, some fundamentals, some adult health, and we want to make sure that you're prepared for whatever they throw at you. So if you're really over prepared for peds, but you haven't reviewed any other content, that's not going to help you answer most questions on your NCLEX. So we want to make sure that you are broadly prepared across all subject areas when you go in, but the NCLEX only expects you to meet the passing standard overall, not in each subject area or in each client need area. So really good question.